And we're going to start the session. Welcome, everyone. Good morning. Thanks for joining us for this session on this workshop. Okay. And please remember to mute yourself for this workshop on virtual implementation facilitation. Steve Bartels from Harvard Medical School and Catherine Dollar from the VA Center for Integrated Healthcare, and myself, Tina Hartman from the VA Bedford Healthcare System, are really excited to be in the room with all of you today, because we are here to tell you a little bit of what we know about virtual implementation facilitation, but we know that there is a lot of experience in the room as well. And we are really excited to learn from all of you. As you can see, I have pen and paper here ready to take my own notes because I know there's a lot of experience in here. And we're going to try to make this workshop as interactive as possible. And the first thing we're going to do is to hold a poll. And so I'm going to turn this over to our host and ask her to administer a quick poll for all of you about your experience with virtual implementation facilitation. So Sandy, I don't know, or maybe it is I who needs to run this poll. This is something we didn't, oh, I'm gonna run it. There you go. Something we didn't talk about in the prep. So you should be seeing a poll asking about your experience, and everybody's responding. That's so terrific. Thank you so much, because this is just the kind of interaction that we are looking for in the way that we want to conduct this workshop. So I see it's starting to level off, and I'm going to end the polling in just another second or two. Yep, here, let me end the polling and share the results with all of you so you can see. So it really is a range of experience, and it looks really very much like a bell-shaped curve here in terms of who we have in the room. And I want to keep that in mind as we move forward with this presentation, because as the workshop progresses, you are going to be part of the people who are participating in sharing your information and sharing your questions. So I'm sorry. Sorry about that. I'm going to have to reshare. So we're going to make this as interactive as possible. And we just did that using a poll. And we're going to have some opportunities to use the chat function as well. So we're going to have questions up on the slide, and we would like all of you, especially given this bell-shaped curve right now, to participate in terms of both sharing your experiences and your questions. If you have additional questions to the one that we have on the slide, please add that in the chat box as well. And at the end of this workshop, we're going to have at least 15 minutes for all of you to participate in breakout rooms, where you're going to be able to apply what we've talked about and what you've learned from other people in this room about virtual implementation facilitation to the projects that you are thinking about as you move forward in this. So let's move right into one of those chats. You see a question here on the screen. We are all really good by now at using virtual platforms to do certain things. It doesn't have to be implementation facilitation. And in either something you've done yourself or something you've seen somebody do, you've seen some amazing ways of engaging participants. Can you start adding those amazing ways of engaging to the participants into the chat box, please? And I'm going to pass it to Catherine to read some of these answers, because I know there are things out there that I haven't heard of yet. So Catherine.
They're coming in quickly. Let's see. I've got several folks saying online polls like we did, Q&A, chats, icebreakers to build reports, rapport, calling on people. I love that one. Google Jamboard for stuff you do on stickies to brainstorm, breakout groups. Yep. Oh, now they're flying in. More saying facilitated breakouts. Nice. Keeping cameras on. Actually, that's one of my favorite strategies too. People are saying mural tool. That's an interesting one. That's new. And breakout groups with case studies.
Excellent. I'm sure there are a lot of others, and we're actually going to be looking at that chat as we move forward. Catherine, thank you so much. That is exactly the kind of interaction we are looking for, because I know I learned some things there. So and I actually heard some terms that I don't know, so I'm going to have to Google them afterwards. But thank you so much for sharing that. This is exactly the kind of interaction that we're hoping will move this workshop forward in directions that are really beneficial to all of you, and not just one-way communication, but think of this as an actual room with, I'm not exactly sure how many, but we've got 63 people in this room right now. Think of this as a room with 63 people who have amazing brains and a ton of experience and lots of questions. And we're going to try to enable you to leverage that as much as possible as we move ahead. So
Christine, you're muted.
I apologize. I'm not sure. I was with my daughter, so I apologize. What is the situation that you need me to do right now?
we're good. We're good. It was tech issues on my part. So we're set here. I'm very sorry. This is the last time anybody's going to ask me to run slides. So let's all get on the same page in terms of implementation. So we're all implementation scientists, and we have an understanding of what implementation facilitation is. And we agree that it's a multifaceted strategy where everyone agrees that quality improvement is the name of the game, and that everyone is invested in improvement, and that relationships are part of facilitating that improvement. There's actually a really strong literature for backing up the evidence that implementation facilitation works really well. And that literature is something that we're not going to discuss here, but I can tell you that there was a 2012 systematic review, and there are lots of individual articles pointing to the effectiveness of implementation facilitation. So if you need to support your choice of implementation facilitation, there's literature and evidence to back you up for that. Today, we're going to be talking about moving that to a virtual environment. So basically taking the in-person completely or partially out of the interactions. And that means that you are going to be using technology. So some of that technology may be new, and some of that technology may be things like conference calls that we have used for a long time. It is important to remember that it's not just your comfort level, but the comfort level of the person whom you're interacting with, or the groups that you're interacting with. So if your site isn't very comfortable with virtual and they would prefer a conference call, it's sometimes okay to push that envelope a little bit, and then other times that creates a lot more stress than is necessary. So I'm going to pass this right now on to Catherine to talk a little bit about the advantages and challenges in virtual implementation.
Yeah, you can move on to the next slide. Oh, go back one for me. Thank you. Perfect. So a few years back, the VA National Center for Organizational Development put together a handbook for working in virtual teams. And although that's not necessarily the same as applying virtual implementation facilitation, we believe the constructs are related and overlapping. And as part of this initiative, they included advantages and disadvantages of virtual teams. And so here's just to highlight a few. So advantages, you have increased flexibility in terms of scheduling, allowing actually more participants to be engaged in the process and extending your reach. And if you think about some initiatives that are doing in-person facilitation, it actually requires time away for the facilitator who may be traveling, as well as time outside of routine clinical work for those participating or receiving the facilitation. There's also, it really enables the work to continue offline and allows for real-time documentation together through working on shared documents. And now a few of the challenges or disadvantages. scheduling across time zones, which can get really, really complicated. If you've ever tried to be somebody on the East Coast, having a virtual facilitation meeting with somebody in either Alaska or Hawaii, it's really, really challenging. And never mind if you're international and you're trying to figure out, okay, now have these people eaten? Who needs to take a break? How do we schedule it? Like, it just gets more complicated, as well as thinking through, all right, now who has to go pick up kids? So that can be a challenge, as well as it's harder to initially build relationships. And so much of implementation facilitation is based on support that occurs in a trusting and caring relationship. So it's just a little bit challenging. But that's, again, there continues to be lots of benefits too. So on the next slide, you can see a few more disadvantages and advantages. So in particular, some of the advantages are increased scalability, spread, and capacity. All those are great additional advantages that you get in virtual technologies. And also a few more disadvantages. It's just harder to monitor fidelity remotely, and it's harder to really get a good sense of exactly what's happening at a site where you're trying to influence change. Then I think we, on our next slide, turn it over to our next presenter.
Great. So I'm going to talk a little bit about frameworks, an example of frameworks for virtual implementation. And what I'm going to do is just select one example just to kind of get the discussion going, in which we applied a PRISM, the Practical, Robust Implementation and Sustainability Model. And if you're not familiar with that model, it really brings together the best of both worlds to some extent. It has in it Glasgow's RE-AIM. You can see adoption and implementation and maintenance, as well as implementation fidelity and effectiveness embedded in this, along with reach, as well as some of the internal and external contextual issues that are present often in CFRs. So here you see that these are multi-level models, or model looking at implementation from organization, providers, and patients to infrastructure, environment, and again, the phases of adoption, implementation, maintenance, and reach and effectiveness are all embedded in this. So if we move to the next slide, to give you an example, we conducted a virtual implementation strategy test. This was a hybrid type 3 effectiveness implementation, RCT, where we compared the effectiveness of a virtual learning collaborative to virtual technical assistance. And so the way that this worked, we had this evidence-based practice that we developed and tested early on, and refined into RCTs, showing there was an evidence-based practice, a health promotion intervention for people with mental illness. We had 48 sites, 3 cohorts, and then randomized these sites to either an 18-month virtual learning collaborative with monthly training and skill building and quality improvement methods and peer group learning, versus a virtual technical assistance intervention on one-on-one virtual support consultation. And we were able to ascertain also our outcomes entirely virtually, in addition to the virtual implementation, including program participation, fidelity, cardiovascular risk reduction at the patient level, and then secondary outcomes of uptake, operation, reach, maintenance, health behaviors, and also organizational change and follow-up. So this was all conducted through a web-based virtual implementation strategy. The next slide shows the core intervention we're most interested in looking at was this issue of whether or not the IHI Breakthrough Virtual Learning Collaborative actually is effective in an implementation process with respect to a new intervention that hadn't been in place before, versus this targeted kind of usual care, so-called technical assistance in education and training. And this consisted of these monthly 90-minute learning sessions, reviews of points learned, homework in between, and posting on the web transparently the results of implementation by each one of the individuals with organizations within the learning collaborative to see how progress was going, and then also to do benchmarking around outcomes, as well as helping each other to do problem solving around those areas where implementation was not going as well. So that was the study. Go to the next slide. One of the things that we learned that actually gets underneath, gets to one of, this is actually, gives you a sense of it being, yes, it was virtual. It was across the country that was operated out of our offices at Dartmouth at the time where I was previously. The next slide shows some of the results. And this kind of underscores, I really selected just a couple, that fidelity was different. And so when you do a virtual implementation, or any implementation, but perhaps more so in virtual, I'm not sure, you could see that in fact fidelity was different relative to the different sites. But of interest, the fidelity was better in the virtual learning collaborative versus the TA, which is kind of interesting. And we thought that was a compelling and interesting demonstration of differences that can occur when you have group-based data-informed support at a virtual level for implementation. The next slide shows that despite the fact that we looked at fidelity, we also saw that there were fidelity consistent and inconsistent adaptations. And a colleague of mine, Kelly Ashbrenner, just presented an hour ago around the adaptation issues in this. And you can see also that there were adaptations were common, and particularly the virtual learning collaborative tended to have more fidelity consistent adaptations as opposed to inconsistent adaptations. So that was also interesting and perhaps provides some foundation here. There are other potential frameworks. I just showed the one that we used particularly, the PRISM, but there's also the replicating effectiveness programs model, CFR, the Consolidated Framework for Implementation Research, PRISM and IPARIS that are also other implementation frameworks that all can be used in virtual settings. So what we'd like to do is move to a chat box interaction again. We talked about some of the challenges that we experienced in our work, or that we observed or thought about in preparing for this workshop. What other challenges have you encountered when you've thought about doing virtual implementation, either theoretically or actually? And we saw that a number of people have had experience in doing that so far. So I'd love to see your thoughts in the chat box in terms of challenges you've experienced, whether it's fidelity or actually implementation or data collection or whatever. So if you could go to the chat box.
All right, we've got a few starting to come in. So lower engagement of the virtual group. Same thing coming up then, keeping individuals engaged and sharing airtime. Re-engaging non-responders, that's really a theme coming up here. And engagement from sites, especially if you're not the boss. Yep, engagement again. Data quality monitoring. Yep, fidelity. Fidelity when you physically can't observe how the process is being implemented. Recruiting sites, yes. Yeah. Muted conversation, that happens too. Competing priorities at a site implementation level, definitely. Oh, wow. Clinicians who have to wear masks because they are meeting from their healthcare setting. Absolutely. Building relationships, I think that's a critical one. Recruitment. Time lost to technical challenges and access to technology. Yeah, the access gap in and of itself is still occurring pretty routinely, actually.
I think I'm demonstrating that.
The issue of LMIC settings was brought up too. You know, is there equity research that will be challenged, particularly in virtual implementation when the technology gaps are potentially larger? Really great point and question.
Yeah.
Okay, so Catherine, thank you so much for fielding those questions and answers. There are certainly a lot of challenges, and some of them we anticipated and we have in our slides, and others maybe we can take a couple minutes at the end of the presentation, or if I have a chance, I'll add them to mine because we're a little bit ahead of our original schedule. So I'm going to take it over now and talk about overcoming some of those challenges. So some of the ones that were mentioned, are things that we have investigated how to overcome in the national work that we're doing in the VA's nursing home system. So I co-direct a center that is tasked with helping the VA nursing homes, and there are 134 of them, improve on quality improvement and QAPI. And in that work, we have done virtual implementation facilitation for interventions in the nursing homes of groups ranging from about 6 nursing homes or 8 to 95 at the same time. And we did this was all pre-2020, where we were doing the virtual work. So we have years of experience doing this virtual implementation facilitation. And one of the mantras that we have is consider everything a pilot. Keep a continuous quality improvement mindset as you are doing work. This applies to just about anything. I think you can just adopt that pilot everything mantra for grocery shopping, whatever. But it is also a mantra for virtual work, because as you just all raised in your answers to that question in the chat, there are a lot of challenges. And so sometimes overcoming those challenges isn't something that you can anticipate, but it is something that you can work at getting better at. And so when we run our sessions, we have debriefs. And it may seem excessive to you, but we have found it very helpful, and we continue to use debriefs. So when we are running a multi-day implementation facilitation training, for example, we do the debrief every day. At the end of every day, we take at least 45 minutes with the whole team. Sometimes we can cut that down toward the end of the sessions, and we just are meeting, for example, for half an hour. But we meet with the whole team and we do a debrief about what went well and what things we'd like to change. So sometimes we pivot in the moment and we change the things that we are going to do the next day. We change the slides, we change the order of the agenda, we change how much interaction we're going to have, we boost things, we tweak things. But that is just an example of how we consider every implementation facilitation touch with the site another opportunity to tweak what we're doing and to learn from what worked well and what didn't, and therefore what needs to change. So one of the things we do early on is a virtual site tour, and you might already be doing this, but site tours were things that if you were on site working with a site, something that of course you would go and take a tour of wherever it is that you were trying to implement an intervention. Now it's possible to do that virtually. And it is important for this aspect of relationship building and engagement. And I encourage you to think of it as a two-way street. So not only is it the site giving you as the facilitators, or if you're working with a larger group, you might have small cohorts. So I'll talk about group size a little bit later, but we often have very large groups. And so we build cohorts of smaller groups where we assign one of our team members as a coach for each group. So that coach is the facilitator for that cohort. But it might not be you who's getting all that information, but it enables those relationships to be built within that cohort among those sites and the coach for that group, or for you as the facilitator. And then consider doing a virtual site tour of your research site so that they know you more as an individual and they understand where you're coming from and what your environment is like. And it's not just their strengths and challenges that are under the microscope, but also yours. And what does your team bring to all of this? The next thing you might do is set an agenda. So you're going to be thinking about what you want to share in each touch with that site during your facilitation process. And each touch is going to have some sort of agenda, whether it's a written out agenda or one that you share at the beginning of a meeting. It's important to watch the clock. So we started this session right on time. We find that sometimes, for example, clinical staff aren't used to meetings starting right on time. We have taken the approach, and this is something that we have learned over time, to start on time, and that eventually people learn the meetings that are held with this group are going to begin on time, and they start coming not just on time, but early. And why do they start coming early? Because we also know it's really important to have a greeter. So when we run a larger training, so this isn't something where you're just getting on the phone call with one person from a site, but you're actually running a larger, more organized training or facilitation workshop for folks. we have a greeter who gets on at least 15 minutes before the actual workshop starts. This is a really upbeat person, and she just keeps that conversation going. So this conversation happens regardless of whether, for example, right now, I can't hear you, but you can hear me, but we can ask you questions. I could be asking you questions, and that's what she does. So she notes as people join the meeting, and if they aren't able to speak themselves, she conducts a virtual conversation with them about topical issues and encourages people to write their answers into the chat, reads those answers. And what that does is not only engage people on a personal level, but also sets the tone for the entire workshop, that this is going to be something pleasant, it's going to be something engaging, it's going to be something that asks you to participate as well. So that we have found is a really powerful mechanism for starting that meeting off, even though it's virtual and could potentially start with really low energy. It starts that meeting off with really high energy. Another thing to do is look through your meeting agendas as you construct them and think about places where you can build in site level activities. So we run, multi-day trainings, for example, or a 6-hour training, and I'll give you an example of something that we are implementing, an intervention that we are implementing. We're implementing something called frontline staff huddles. And those are huddles that, even though some of the nursing homes have been doing a lot of different types of huddles, the kind that we are teaching, they haven't done before. And so certainly part of our facilitation is to train them on why those huddles are important, the evidence base, the structure of trying to do one of those huddles. We also have them do a role play. We have them watch a video, and then we have them role play a video of how these huddles can go. And then we have them do a role play with a script that we have templated out for them, where everybody gets a chance to, or at least some people get a chance, depending on the group size, to be a facilitator for the huddle with participants who aren't necessarily that eager to be part of the huddle. So we've done all this prep work, and then we've built into the agenda, and we learned to do this over time, an hour that they knew about ahead of time. They got supporting materials ahead of time, and they were able to prep their staff ahead of time that, let's say at 3 p.m., they would come out and they would do a huddle with their staff. So they actually took that knowledge that we had just taught them and immediately applied it. We asked them to do a debrief with their team afterwards, and then come back to their larger group, whether that was their cohort or the whole team, and report out on how that went, so that we could hear about the successes, hear about what facilitated it to make it go well, and hear about the struggles, do some just-in-time teaching in course correction in real time, so that they had an opportunity not just to learn intellectually, but actually go out and apply. So the virtual environment is very positive for this kind of thing, especially if you're running a training with multiple groups. If you think about it, if you were all in Orlando, Florida, but none of the sites was from Orlando, Florida, but that's the place where you were having your meeting, nobody could go out and practice what they were doing. If you have a virtual environment, you have opportunities that you didn't have before. And so it has been our experience that these are very powerful moments when built into the agenda. So not just telling them, oh, go home and try it yourself, but try it right now. We're going to come back and talk with you about how it went. This gets into the importance of templating. So more and more and more, we template just about every interaction that we have with the sites. This provides a structure for them. It gives them materials that they can go back and look at afterwards. And as you'll see in the next 2 slides in the examples, it helps them think through and know what they know. So in this example, this is a template for something where they have an intervention that they are supposed to implement at their site. And in the left hand where the circle is, these are the key points that are from the training that they just took. So it reminds them of their key lessons, the things that they know, but that might have just popped out of their mind. And then on the right hand side where you see those arrows, those are the questions. Those are those guiding questions as they work with their staff to train their staff on how to do this intervention. These are the questions that they are thinking through, and we encourage them to take notes on their answers, because we also have reporting back periods and we structure those as well. So in the beginning, we used to just ask sites, we have an action period, it's a month, and you're going to implement this at your site, and we'll talk with you every week, and we'll have your coach work with you, etc. And then when we all come back together as a big group, we'll have you you will have you report out. We now structure that reporting out because you can imagine that, and you probably know from your own experience, that really engaged sites, boy, do they want to report out. And those sites that really struggled with this, they're like, let those engaged sites talk about it. We're not gonna really speak up. So we give them a PowerPoint that is like this, but this is just condensed. So each of those latter 3 bullets would be a separate slide, and they have 5 minutes. And the word at the top of this is metacognition. That is taking the knowledge that you have and processing it, thinking about it, writing it down, talking about it, and that takes your own learning to a much deeper level. So we help them do that process of metacognition by reporting out, and because everybody has the same amount of time, we're hearing from all the sites instead of just the ones that want to talk a lot. So hearing from everybody is a theme in what I've been saying, and it's really important. Group size matters. We've learned that you can really only hear from 10 to 12 people. And if you only have one person reporting per site, you could have a cohort of 10 to 12 sites. If, like us, you have a 4-member team per site and you want to really hear from each member of that team, you might want to limit your cohort size to 3. It also depends on how many support staff you have to be able to put a coach in or a facilitator in with each of those cohorts. But we find group learning is so important, and group size is important as you go around the room and hear from everyone instead of just letting those people who want to talk a lot do all the talking. So this engagement in a virtual environment relies on technology, and some of you talked about that in your answers to that chat question. We definitely believe in always having a backup plan, assigning roles, and I'll talk a little bit more about what kind of roles we assign on the next slide, but we actually do a virtual run through of every training that we do, and that may seem excessive to you, but it means that the first thing that they see is not our first rodeo, and that makes a really big difference in making a good impression. Here are some of the roles that we assign our virtual teams to take on, and so the roles here are not necessarily one person only has one role. Some of these roles can be assigned to more than one person at the same time. I'm going to call out 2 that might not jump out at you right away. One is stopping and starting the recording. If you're recording, don't make the presenter the person who is responsible for that. That should be somebody other than the presenter doing that. And then the chat. The chat often has so much useful information. So we've learned over time to figure out the mechanism by which we can copy that into some sort of program, be it OneNote or Word, so that we can have a copy of that chat for later. It gives you information about what the sites are doing. It gives you information about their struggles and their successes, and it gives you information about what kind of facilitation you are doing and what you called out when you were looking at that chat. And the last thing is plan for failures. So when we run these multi-day or multi-hour sessions, we always have a text chat in the background. So obviously the presenter can't be looking at that chat, but everybody else can, and they can be planning eagerly for what is going well and what isn't. And as you see in this example here, our consultants had technical issues, and then we were starting to plan for what to do if B&F, who are our consultants, couldn't be on. And then B&F said, oh, we're back online. Everybody said, phew. So this is the kind of stuff that goes on behind the scenes that enables things to move forward in a smooth way if we can. So we have a chat here, and we'd like to hear about strategies that you have for overcoming challenges. I've talked about some of them, but I'm sure you have others. You raised a lot of issues, and raising issues also means that some of you have experience in overcoming some of those issues. So I'm going to pass this to Steve to read some of those answers that are coming in the chat.
Great. So what sort of suggestions do you have, other things for overcoming challenges as you've thought about them? So meet your site team where they are. Makes sense. Get a sense of who you're working with and really understand where they are in their process and implementation. Sessions where everyone has a chance to introduce themselves from the beginning, breaking the ice, really spend that time. It takes time, but it's important. Over-prepare for ASL, for kindness in the group if things go sideways. So discussion boards for offline communication, engaging across teams. Gathering everyone's FB, rotate who goes first, Keep the quiet folks engaged, you bet. That's that observation about people who are sometimes more quiet or more conflicted about their progress. Prioritize building rapport and relationships to increase engagement. They're really important to keeping people engaged. Ask participants about their preferences. What do they want to do? What processes they like? Outload, independent thinking time, breakouts. Give an overview of how to use technology before the meeting so they can familiarize. Don't assume that people really understand these different technological platforms. Always complete introductions whenever there's a new person who joins a session. So that's a welcoming way of bringing new people in, getting people to know each other, maybe repeating the introduction so people begin to associate people with their faces and names when they haven't worked face to face. Great idea. Those are opportunities to kind of reintroduce and retell your stories.
Steve, thank you so much. Those are
yeah.
great. I really appreciate those. They really summarize a lot about engagement and the importance of meeting people where they are in terms of technology, in terms of what their need for relationship building is. And in terms of what we're going to do next is we're going to ask all of you to hop into some breakout rooms. We're actually going to facilitate that for you. These are going to be randomly assigned breakout rooms. And what we're going to ask you to do in those breakout rooms is think about a project. So you may have one ongoing. You may have one that you did in the past that you were thinking about, well, how could I have done that virtually if I want to move this work forward in a different way, or something that you want to do in the future. So please jot down for yourself these 5 questions. You can just have those keywords: project, challenges, advantages, framework, and strategies. And when you get into those breakout rooms, we're going to ask all of you to please assign one person to take notes in some sort of electronic format, so that when you all come back together, we're going to have some time here at the end of the breakout rooms to have a discussion. And that discussion is going to focus on the discussion that you all have had in your breakout rooms. So assign somebody to take electronic notes so that they can then copy those notes into the chat so that everyone can see the kind of discussion that all of you had in your breakout rooms. And the approximate time limits here are also written at the bottom, and it's the time that it's going to end is not going to be necessarily 2:38, although it'd be very close to that. It's going to end 15 minutes after you hop into those breakout rooms. So we're going to ask our wonderful tech expert from Confex to pull you into those breakout rooms right now. Again, talk about project, challenges, advantages, frameworks, and strategies. And make sure you take electronic notes, please, because we are looking forward to hearing what you talk about.
There's a request to put these in the chat, actually, these questions, if we can.
Excellent. Okay, we'll do that too.
Great. Well, now we're back. This is fabulous. Look at all the...
Yeah, it's so fun to see everybody as they're coming back in.
So what we're hoping is that if you have a chance to either just cut and paste into the chat or write into the chat some of the things lessons learned that you had, or themes, maybe even 1 or 2 word themes that really were important in your discussions. And we'll do the best we can to kind of read some of those off as we go. So if we could start with that. Let me see, I'm wondering if we're already there. So modifications and adaptations are necessary. These are things that are likely to happen. The advantages of a large amount of people, stakeholders, saving on travel accommodations. The good news of going virtual with COVID, there aren't many, is that there was money left over for technology. And so we've all had to kind of learn fast how to quickly transition to these opportunities. Having clear processes, timelines, clear, concrete, get those people on the calendars, pilot testing, video. Those are all things that are essential strategies that can work in these instances. Other thoughts about things that you learned. Recognizing and balancing the stress of participants with needs of researchers and participants. Always attention, and how to do that virtually, perhaps even more complicated. Measuring engagement is challenging for sure. And here's a set: challenges engagement, both virtual and in person, particularly challenging in the virtual environment when people have multiple tasks distracted. I don't know about you, but I never multitask when I'm on Zoom. Have very specific tasks to be completed ahead of the meeting. A lot of homework beforehand and homework afterwards. Give back a plan when folks do not attend. And it's probably not the case of people who necessarily watch video recordings. So how do you do that in a parsimonious way? Accountability, providing data, access to outcome tracking from the meeting, really helpful and important in terms of deliverables. Challenges, less ability to pilot live facilitation before adapting the strategy. So adaptation, hard in a virtual environment. Major theme of building connections is a challenge, picking who to connect with in organizations, lacking understanding of the organizational hierarchy and structure. Do research to learn who they've been working with. Main challenge in establishing connections, getting engagement, and the approach of developing a website to share information. So going from having established relationships to going on the web, easy, starting new applications, new relationships, hard. COVID has impacted research significantly, you bet. Organizational culture and expectations during COVID, huge impact on intervention delivery. Much more difficult to evaluate the actual use and implementation of the intervention because a lot of it's by report. Requiring a lot of flexibility. Getting to know a new team or two new members of the email. Tell me about yourself over lunch, maybe having informal breakouts around just social connectedness, not just the work plan. Really interesting idea. Frameworks, internal theoretical frameworks centered on basic implementation models with an emphasis on sustainment. EPI, the EPIS framework or CFR. Strategies, have a set of tools that you're confident, familiar with using that match the skill set of the group implementing, not just yours. Those boots on the ground, those people need to be able to use pragmatic tools, things that make sense, that are easily adopted, and perhaps a little less theoretical, which we love our theory, don't we? But things that the people out in the trenches really get to use. Challenges, older adults able to navigate the virtual platform in person. It's always more engaged there. Piloting the virtual curriculum, never getting to try it out on a live environment and having to go straight to virtual is really hard. Curriculum is new, wanting to pilot it live, but not being able to do that. Tips, get feedback from end users on their preference, virtual now or in person, but delay a few months. So take the time to get an iterative feedback around how people want to learn, get the implementation of the particular thing you're doing, use chat and virtual comments, test and pilot things out, but overdo your homework, I guess, around end user input and end user co-design, perhaps, I'm hearing. Think about how to do that using chat and other sorts of other approaches.
And Steve, I'm going to have to cut you off there. This chat is fantastic, but we now only have about a minute left for this workshop. So I want to ask you and Catherine, I can't believe how quickly you got through that chat with commentary on the side. This is a new career for you, is to be some sort of chat commentator. People could hire you for that. So Steve and Catherine, do you have any final comments you'd like to make with the group?
I would say kind of the lessons learned here I'm taking away are definitely be over prepared, definitely be creative, definitely look for new strategies, as well as using the frameworks and building in extra attention to making sure you can build the relationships and giving that the additional time and energy.
And what I'm hearing also is overdo the end user kind of input, and access to what people want, meeting them where they are. Much easier to do when you're sitting next to somebody at a meeting or doing an implementation on site. Really hard to think that through and solicit it. So calling out to people, using creative ways to get opinions around what people need.
Great. And I'll just add that I also heard sometimes the old-fashioned way works better. Sometimes virtual means sending something in paper or defaulting to a technology that has been in existence for 100 years instead of something newfangled, because you're meeting the people exactly where they are. So we'd like to thank everybody so much for joining this session. This has been a great experience for us. Thank you for bearing with us through the technological snafus, and we learned a lot from your participation. So thank you for being such an engaged group.